My name is Camilla Nykjaer. I'm a lecturer in nutrition, physical activity and public health with the School of Biomedical Sciences. My research looks at how we can better support healthy lifestyle behaviours during pregnancy and following birth, in particular the relationship between physical activity and health. This research matters because pregnancy and the period after birth are two key life stages where women, they often take a step back and they reflect on their health. And my research looks at how we can bridge the gap between guidance and implementation in practice. I kind of always knew that I was destined for research, even as a young child, as a teenager as well. I love to do some really deep dives into topics. Sometimes I get a bit carried away, but you need that curiosity in research. It's also personal experience. So my family, my parents, they really struggled to conceive, and that has really sparked my curiosity to make movement in this field, looking at physical activity in pregnancy and postpartum. One of the key things that surprises people when it comes to my research is that actually being physically active during pregnancy and in the postpartum period, it's not necessarily a motivation problem. Most women, they want to be active. They know it's good for their health. They know it's good for the health of their baby. The same can also be said for clinicians. They know that physical activity is a positive health behavior. They want to be able to provide advice around physical activity to their patients, but they are constricted by a healthcare system that is under pressure. We've got all the guidance, we've got really good guidance, we've got really good knowledge in terms of how we can treat these health conditions, but we're not seeing that guidance being implemented in practice because there is a system that is not supporting practitioners or patients. In an ideal world, I would obviously like to see my research making a direct difference for practice. So a good example is how I have helped develop a patient information booklet for women that enter pregnancy with a BMI above 40. So what I have done in collaboration with Leeds Teaching Hospital midwives is develop a patient information booklet around healthy eating, around physical activity, movement that is sensible, that is realistic as well, to support these women in making healthy lifestyle choices. What is really important is that we listen to the women and that we make sure that the advice that we provide is culturally sensitive. That includes working with ethnic minorities, it includes working with disabled populations, it includes working with a range of communities and population groups, and ensuring that the advice that we provide or our practitioners provide is suitable for all.